It is 9 o'clock in the evening. You are on the couch, half watching the news, half thinking about tomorrow. The dishes are done. The dog has been walked. You feel completely normal, maybe a little tired, but who isn't at this hour? You brush your teeth, set your alarm, and turn off the light. Nothing about this night feels different from any other night. But inside your skull, something has been building for years, and it is now very close to the end of its patience. A blood vessel that feeds your brain has been narrowing slowly, quietly, for a decade or longer. Tonight, that vessel is almost closed. Blood is still getting through, but barely. Your brain is running on its last reliable supply line, and within the next 24 hours, that supply line will shut down completely. Here is what nobody explains clearly enough. A major ischemic stroke almost never arrives without warning. In the final 24 hours before the vessel closes for good, your brain sends out distress signals. They are short, they are strange, and they vanish so quickly that almost everyone who experiences them talks themselves out of taking them seriously. That is the difference between the people who catch a stroke before it happens and the people who wake up in a hospital bed, unable to move half their body. By the end of this video, you will know exactly what those warning signals look like, what is physically happening inside your brain each time one appears, and precisely what to do the moment you recognize one. But first, you need to understand what has been going on inside your arteries to bring you to this point. Picture a garden hose that someone has been slowly pinching shut over 10 or 20 years. Water still flows, but the stream is weak and turbulent. That is your carotid artery right now. The inner wall has been collecting fatty deposits, what doctors call plaque, layer by layer. The opening that was once wide and smooth is now rough, stiff, and narrowed to a fraction of its original size. But here is the part that actually determines whether you have a stroke this week or not. Not all plaque is the same. Some plaques are dense, stable, and calcified. They narrow the vessel, but they sit quietly. The dangerous kind is what vascular specialists call an unstable plaque. It has a thin, cracked cap, like a blister that is about to pop. Underneath that fragile shell sits a soft, fatty core loaded with inflammatory cells. In the final 24 hours, microevents start accelerating around that plaque. Tiny fragments break off the cracked surface and float downstream toward the brain. The already tight vessel goes into brief spasms that momentarily choke blood flow to zero. Platelets, the sticky repair cells in your blood, begin piling up on the rough surface, forming the early scaffolding of a clot. Your brain is still working because it has backup routes, smaller arteries called collaterals that can reroute blood around a partial blockage, but those collaterals are maxed out. They are compensating at full capacity with nothing left in reserve. One more clot fragment, one more spasm, and there is no alternative path left. That is the 24-hour window. It is not an arbitrary number. It is the final stretch of a physical process that is building toward a tipping point. And during that stretch, your brain tries to warn you. The first warning your brain sends often comes through your eyes. You are making breakfast, reading the paper, or looking out the window, and suddenly a gray wave slides across your vision in one eye. Not both. One. It is like someone slowly pulled a dark curtain from top to bottom, or smeared a layer of dirty water across the lens. The world goes dim or completely black on that side for a few seconds. You blink. You rub the eye, you tilt your head, and just as quickly as it came, it clears. Vision returns to normal, and you blame it on tiredness, dry eyes, or staring at a screen too long. Here is what actually happened. A microfragment of that unstable plaque we just talked about broke off from your carotid wall and traveled upward. It reached a fork in the artery and took a turn into the ophthalmic artery, the small vessel that feeds your retina. That fragment wedged itself into the opening and blocked blood flow to the light-sensing tissue at the back of your eye. For those few seconds, the retina had no oxygen, no fuel, and it went dark. When the fragment dislodged and floated on, blood flow resumed, and your vision came back, so you felt lucky. You were lucky. But not for the reason you think. The ophthalmic artery is a direct branch of the internal carotid, the same artery that supplies your brain. That fragment happened to turn left toward the eye. If it had continued straight, it would have lodged in a brain artery, and instead of a 5-second blackout in one eye, you would be looking at permanent paralysis, lost speech, or death. When this happens within the final 24 hours, it means something very specific. The plaque surface is actively crumbling right now. It is shedding debris into your bloodstream in real time. The next fragment may not take the same turn. The second warning often shows up in your hands. You are holding a coffee mug, writing a note, or reaching for your phone, and suddenly the fingers on one hand stop cooperating. The mug feels impossibly heavy and starts to slip. Your handwriting turns into a shaky scrawl that does not look like yours. Or your grip simply vanishes as if someone switched off the power to that hand. It lasts maybe 30 seconds, maybe 2 minutes. Then the strength comes back, the coordination returns, and you shake your hand out and carry on with your morning. You might blame it on how you slept, or think you pinched a nerve, but there is a critical difference between a nerve problem and what just happened. Carpal tunnel, a pinched nerve in the neck, or sleeping on your arm all involve compression of a nerve outside the brain. They produce tingling that builds gradually. They affect specific fingers in a predictable pattern, usually the thumb and first 2 fingers or the ring and pinky, and they ease up when you shift position. What you just experienced is nothing like that. It hit suddenly. It affected your entire grip and coordination, rather than just sensation in certain fingers, and it disappeared just as abruptly as it arrived. That pattern points to the brain, not the wrist. A specific zone of your motor cortex, the strip of brain tissue that sends movement instructions to your hand, briefly lost its blood supply. When flow dropped, the hand lost its orders. When flow returned, the hand came back online. One more detail that matters. Stroke warnings are almost always one-sided. Your left brain hemisphere controls your right hand, and vice versa. When both hands go numb symmetrically, that usually points to a spinal or nerve issue. But sudden clumsiness or weakness in one hand alone, appearing out of nowhere and resolving on its own, is your brain telling you that its blood supply is failing on one side. The third warning attacks your words. You are talking to your spouse at the dinner table, answering a cashier at the grocery store, or calling a friend on the phone, and mid-sentence, your speech falls apart. The words come out slurred, as if your tongue suddenly doubled in size. Or you reach for a simple word like kitchen or Tuesday, and what comes out is something entirely different, a word that makes no sense, and you can hear that it is wrong, but you cannot fix it. Your brain knows exactly what it wants to say. The message is clear in your head, but somewhere between the thought and your mouth, the signal breaks. It lasts a minute, maybe 2. Then it clears. You finish your sentence normally. Your spouse gives you a strange look. You laugh it off and say you lost your train of thought. You did not lose your train of thought. Your brain's language center lost power. There are 2 main speech regions in your brain, both typically in the left hemisphere. One, called Broca's area, controls the physical formation of words. It sends precise instructions to your tongue, lips, and jaw. When blood flow drops to that region, you know what you want to say, but the machinery that produces speech jams. Words come out slurred, choppy, or stuck. The other region, called Wernicke's area, handles comprehension and sentence construction. When that zone loses flow, you may speak fluently but produce complete nonsense, words in the wrong order, substitutions you cannot catch, sentences that sound confident but mean nothing. When either of those breakdowns appears suddenly and then corrects itself, that is not stress. That is not being tired. That is a language center that briefly lost its blood supply and then got it back. It means the circulation feeding that part of your brain is critically unstable right now. You just heard 3 warning signs that most people ignore until it is too late. Knowing them is the first step. Acting on that knowledge is what actually saves your life. Most people watch a video like this, feel a wave of concern, and never do a single thing about it. Here is what I would tell you if you were sitting across from me in my office: go get screened. Care Health is a free platform that connects you with stroke screenings, cardiovascular evaluations, and clinical trials for heart and vascular disease in your area. You fill in a short form, date of birth, gender, a couple of basic questions. It takes 30 seconds, costs nothing, and Care Health matches you with options near you. Click the link in the description or scan the QR code on your screen with your phone camera. Now back to what you need to know, because there are 2 more warning signs most people have never even heard of. The 4th warning hits your balance. You are standing in the kitchen or walking down the hallway toward the bedroom, a surface you have crossed 1,000 times, and the world suddenly lurches sideways. This is not gentle lightheadedness. This is not the slow wooziness of standing up too fast. The floor tilts violently, as if the entire room shifted 15 degrees in one direction. You grab the counter, the door frame, anything solid, and hold on. Your legs feel heavy and uncertain underneath you. Your eyes cannot make the room sit still. And then within a minute it passes. Everything stabilizes. You let go of the counter, take a few careful steps, and everything feels normal again. So you blame it on an inner ear issue, low blood sugar, or not sleeping well. Here is what actually happened. The back of your brain is fed by a separate set of arteries called the vertebrobasilar system. These vessels run up through the bones of your neck and supply the cerebellum, the brain structure responsible for balance, coordination, and spatial orientation, and the brainstem, which controls many of your most basic survival functions. When blood flow through that system drops sharply for even a few seconds, the cerebellum essentially short circuits. Balance, spatial processing, and limb coordination all glitch at the same time. That is the violent tilt. There is a common type of dizziness called benign positional vertigo that is triggered by specific head movements, rolling over in bed, or looking up quickly. It is caused by tiny crystals shifting inside the inner ear. It is predictable, it has a clear trigger, and it follows a recognizable pattern. A vascular episode is different. It is spontaneous. There is no trigger. You are not moving your head. You are just standing or walking normally. And it is often accompanied by something benign. Vertigo does not produce a strange heaviness in one arm or leg, brief double vision, or difficulty swallowing for a few seconds. Vertebrobasilar TIAs are among the most commonly misdiagnosed warning signs in all of neurology because both patients and many doctors default to the explanation of an inner ear problem. That default can cost you everything. The fifth warning hides in plain sight because everyone gets headaches. But this one is different, and if you have ever experienced it, you already know something felt wrong, even if you could not explain why. It arrives suddenly. Not the slow, dull build of a tension headache over the course of an afternoon. This one hits like a switch was flipped, a deep, crushing pressure behind one eye, a sharp band tightening across your forehead, a throbbing at the base of your skull that peaks within seconds and feels like nothing you have had before. You reach for ibuprofen, you lie down, and after 10 or 20 minutes it fades, so you move on with your day. Here is what most people do not know. Your brain itself has no pain receptors. You could touch brain tissue directly and feel nothing. But the blood vessels that feed your brain are lined with pain-sensing nerve fibers. When a brain artery spasms or a clot partially blocks flow, the vessel wall stretches abnormally and those nerve fibers fire. That is the headache you are feeling. It is not coming from your skull, your sinuses, or your neck muscles. It is coming from a blood vessel in distress. Neurologists have a term for this, a thunderclap headache, and they treat it as a vascular emergency until proven otherwise. The distinction is simple but critical. A tension headache builds gradually over hours and responds to rest or a mild painkiller. A migraine follows a pattern you have learned over years, often with known triggers and a recognizable progression. A vascular warning headache arrives instantly, feels fundamentally foreign compared to anything in your normal experience, and may come paired with one or more of the signs we already covered. A momentary vision blackout earlier that morning, a brief episode of hand weakness, a few seconds of slurred speech. When a headache that does not belong shows up alongside any of those, your brain is no longer whispering, it is shouting. Now here is the question that should bother you. If these 5 warning signs are so specific, so recognizable once you know what to look for, why do the vast majority of people ignore every single one of them? The answer is not stupidity. It is not recklessness. It is a feature built into your brain called normalcy bias. Your brain is wired to interpret new and unusual signals as variations of things it already knows, rather than as evidence that something dangerous is happening. It is a survival shortcut that works well most of the time, but in this situation it can kill you. A gray shadow crosses one eye for a few seconds. Your brain files it under tired eyes, too much screen time. Your hand goes clumsy and drops a mug. Must have slept on it wrong. You slur a word at dinner. I was just distracted. The floor tilts. Low blood sugar, probably. A strange headache hits and fades. I need to drink more water. Each explanation sounds perfectly reasonable in the moment. That is exactly what makes normalcy bias so dangerous. It gives you a comfortable, logical reason to do nothing, every single time. Clinical records show the same pattern over and over again. A patient experiences 2 or 3 of these episodes across 12 to 24 hours. Each one gets rationalized, filed away, forgotten. The patient goes to bed feeling fine, and in the morning they wake up with a full stroke, or their family finds them unresponsive. The tragedy is that every one of those episodes was the brain screaming for help, and everyone was talked away with a reasonable-sounding excuse. And here is the part that should make you angry. Nobody teaches this. There is no public education campaign explaining what a TIA looks like the way there is for heart attack chest pain. Most people can describe the signs of a heart attack. Almost nobody can describe the signs of a stroke in the 24 hours before it happens. You are learning this in a video right now because the system never prioritized teaching it to you in a clinic. Now I want you to see the 24-hour window not as an abstract concept, but as a countdown with specific stages, because understanding the timeline changes how seriously you treat every single episode. Hours 24 to 12. The surface of that unstable plaque is beginning to crack and shed. Small fragments of fatty debris and platelet clumps break off intermittently and travel toward the brain. Most of them are tiny enough that they plug a small vessel for a few seconds and then move on. This is when the first TIA episodes appear. A brief shadow in one eye, a moment of hand weakness. They are short, separated by hours, and easy to dismiss because in between them, you feel completely normal. Your brain is still compensating. Collateral blood routes are still picking up the slack, but the plaque surface is deteriorating with every fragment it loses. Hours 12 to 6. The damage to the plaque surface has now exposed the raw, roughened tissue underneath. Platelets are sticking to that surface faster than they are being cleared away. A clot is forming directly on the plaque, layer by layer, like wet snow packing onto a rock. The opening in the artery, already narrow, is getting tighter. TIA episodes may come more frequently now, or last slightly longer. A speech episode that would have resolved in 30 seconds earlier in the day now lingers for 2 or 3 minutes. The collateral routes are straining. They are still working, but they are approaching their limit. Hours 6 to 1. The clot on the plaque has grown large enough that blood flow through that segment of the artery is barely a trickle. The collateral routes are maxed out, running at full capacity with nothing left in reserve. Warning signs may begin to cluster, 2 or 3 episodes within the same hour. A moment of dizziness followed 20 minutes later by a hand going weak, followed by a strange headache that peaks and fades. Each one is the brain losing blood supply for seconds at a time as the remaining flow fluctuates. This is the final stretch. The system has no margin left. Hour 0. The vessel closes. The clot, combined with the plaque, completely occludes the artery. Blood flow to the brain tissue downstream stops, and now the clock switches from hours to minutes. Brain cells deprived of oxygen and glucose begin dying at a rate of roughly 1.9 million neurons per minute, not per hour, per minute. The warning signs are over. The stroke has begun. Everything that happens from this point forward depends on how fast you get to a hospital. That is why the next part of this video may be the most important thing you hear today. If you or someone near you experiences even one of the warning signs we covered, even if the symptom has completely passed and you feel fine again, here is exactly what to do. Do not wait to see if it happens a second time. That wait is the most dangerous decision you can make because the next episode may not be a warning. It may be the stroke itself. Do not drive yourself. If you lose vision, speech, or control of an arm for even a few seconds while behind the wheel at highway speed, you are a danger to yourself and everyone on the road. Have someone else drive you or call emergency services. Do not take aspirin, blood thinners, or any medication on your own. This is where people make a critical and potentially fatal mistake. There are 2 types of stroke: ischemic, where a clot blocks a vessel, and hemorrhagic, where a vessel bursts and bleeds. Blood thinning medication can help in certain ischemic situations, but in a hemorrhagic stroke, it accelerates the bleeding and can kill you faster. No one, not even a doctor, can tell the difference between these 2 types by looking at you. The only way to know is a CT scan in a hospital. Do not gamble with a pill before that scan happens. Call emergency services or get to a hospital immediately. While waiting, lie down with your legs slightly elevated above chest level and your head in a neutral position, not bent sharply forward or thrown back, so the blood vessels in your neck are not compressed. Do not eat or drink anything, in case you need imaging or a procedure that requires an empty stomach. Do one more thing that most people forget. Time your symptoms. Write down or tell someone when the episode started, how long it lasted, and which side of your body was affected. That information is critical for the stroke team because it determines which treatments are still available to you. Clot-dissolving medication is most effective within 3 to 4.5 hours of symptom onset. After that window closes, options narrow sharply. Every minute you spend debating whether it was serious, whether you should bother calling, whether you are overreacting, is a minute of brain tissue you cannot get back. Everything we just covered is about recognizing an emergency and reacting to it, but the real power is in catching the problem before you ever reach that 24-hour window. There are 3 evaluations you can ask your doctor about that look directly at the machinery behind a stroke. None of them are exotic, none of them require a hospital stay. They are reasonable conversations to have at your next appointment, especially if you are over 50 or carry any of the common risk factors. The first is a carotid duplex ultrasound. This is not a basic scan that just shows the shape of your artery. Duplex imaging shows 2 things at once: the physical structure of the vessel wall and how blood is actually moving through it. It can reveal whether plaque has built up inside your carotid artery and how much of the opening is blocked. It can also detect turbulent flow, blood speeding up and swirling as it squeezes through a narrowed segment, which is one of the clearest signs that a vessel is in trouble. When the narrowing exceeds roughly 70%, doctors call that hemodynamically significant. That means the blockage is severe enough to meaningfully restrict blood flow to the brain. At that point, the question shifts from whether a stroke could happen to when it will happen if nothing changes. In many of those cases, a procedure called carotid endarterectomy, where a surgeon opens the artery and physically removes the plaque, can prevent the stroke entirely. It sounds aggressive, but it is a well-established, routine surgery that saves tens of thousands of lives every year. If you have risk factors, asking about a carotid ultrasound is not being paranoid, it is being informed. The second test is a blood test called glycated hemoglobin, or HbA1c. This is one of the most useful and most underused tools in vascular medicine. Here is what it does. Hemoglobin is the protein inside your red blood cells that carries oxygen. When blood sugar is elevated, glucose molecules attach to that hemoglobin and stay stuck for the life of the cell, roughly 3 months. The HbA1c test measures what percentage of your hemoglobin has become sugar-coated. That gives your doctor a picture of your average blood sugar over the past 3 months, not just a single snapshot from one morning when you happen to fast properly. This matters enormously for stroke risk because chronically elevated blood sugar damages the endothelium, the microscopically thin lining on the inside of your arteries, long before anyone officially diagnoses you with diabetes. That gray zone called pre-diabetes, where sugar has been quietly high enough to injure vessels for years, is exactly what HbA1c catches. The numbers are clear. Below 5.7% is normal. 5.7 to 6.4% is pre-diabetes. 6.5% and above typically indicates diabetes. If you have never had this test, or if it has been years since your last one, it is worth bringing up. The third evaluation is Holter monitoring. In simple terms, a 24-hour recording of your heart rhythm. A standard electrocardiogram in a clinic lasts about 10 seconds. That is a single snapshot. If a dangerous rhythm problem shows up for 15 seconds twice a day and hides the rest of the time, a 10-second recording will almost certainly miss it. A Holter monitor is a small device you wear for a full day while you go about your normal routine. It captures every beat, every pause, every irregularity across 24 hours. The rhythm problem it is specifically designed to catch is atrial fibrillation. In atrial fibrillation, the upper chambers of your heart stop beating in an organized rhythm and instead quiver chaotically, sometimes at rates of 300 to 400 contractions per minute. When the atria quiver instead of pumping, blood does not flow out cleanly. It swirls and pools. And in that stagnant swirling blood, clots form easily. Those clots can shoot out of the heart, travel up to the brain, and lodge in an artery. That is a cardioembolic stroke, and it tends to be severe. Many people with atrial fibrillation have no dramatic symptoms. They notice an occasional skipped beat, a brief flutter in the chest, and they blame it on caffeine or stress. Holter monitoring is what catches these hidden episodes. And if atrial fibrillation is found, there are well-studied anticoagulant medications that, when prescribed and monitored properly, can reduce stroke risk in that condition by roughly 60 to 70%. That is not an inevitable outcome. That is a risk you and your cardiologist can actively manage. Stepping back from the details, here is what this video comes down to. Your brain does not fail without warning. In the final 24 hours before a major ischemic stroke, it sends you specific, recognizable distress signals: a shadow or blackout crossing one eye, sudden weakness or clumsiness in one hand, words breaking apart mid-sentence, a violent, unexplained tilt of the world around you, a headache that arrives instantly and feels like nothing you have experienced before. These are not random glitches. They are not signs of aging, tiredness, or stress. They are the final signals from a brain that is about to lose its blood supply. and every one of them is a chance to act before the damage becomes permanent. Knowing what they look like turns a catastrophe into a preventable event, but knowing is not enough on its own. Understanding without action changes nothing. Write down your risk factors. Bring what you learned here to your next doctor's visit. Ask directly about carotid ultrasound, glycated hemoglobin, and Holter monitoring. Have a real specific conversation about your vascular health rather than walking out with a vague, everything looks fine and no actual numbers. Everything in this video is for your understanding and education. Your situation is specific to you, and using this as a starting point for a real conversation with your doctor will always be more useful than trying to manage things on your own. And if you have not done it yet, that free stroke and cardiovascular screening link is still in the description. 30 seconds could genuinely change your outcome. Take care of yourself.